Welcome, everyone. Thank you for joining us today. I'm Teresa Marentat, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Today, we are reporting an increase of 93 new cases of COVID-19 in Windsor and Essex County. Of the 93 cases, 36 are close contacts of confirmed cases, 28 are community acquired, 1 is outbreak related, 1 is travel related to Michigan, and 27 are still being investigated. We have had 14,602 cases since the beginning of the pandemic. 13,741 cases are now resolved, and 452 people are active at this time. There are 366 preliminary or confirmed variants identified in Windsor-Essex. Currently, 129 of our active cases are variants of concern, which is 28% of our total active cases. 19 people are currently in the hospital and 4 people are in ICU. Our community has lost 409 people to COVID. There are currently 9 active outbreaks in Windsor and Essex County, 6 workplace outbreaks, and 3 school outbreaks. Now for the vaccine update. A total of 124,594 doses have been administered to Windsor-Essex County residents. 112,044 people have received at least 1 dose. Regarding our mass immunization sites, people living in specific postal code areas who are age 50 years of age and older are now able to book their appointment. Postal code neighborhoods beginning with N8X, N8Y, N9A, N9B, N9C, N8H, and N9Y will be able to book. When you attend your appointment, please bring proof of address, whether it be your driver's license, current bill, utility bill, or other bill. Please note that whether you are booking online or by phone, the available appointments are the same. The call center does not have access to appointments outside of what you see online. If you are booking online, please go to wevax.ca. You will be asked to enter your address, the municipality in which you live, Windsor, Kingsville, or Leamington, and your postal code. Alternatively, you can call our call center at 226-773-2200, and someone will be able to help you book your appointment. If you do not have a health card, also please call that number, 226-773-2200, to book your appointment. For general inquiries regarding vaccination, please call 211. We'd like to remind you that despite the vaccine rollout, public health guidance is still necessary. Maintain a 2-meter distance from anyone outside of your household. Wash your hands with soap and water or use an alcohol-based hand sanitizer. Wear a face covering in public spaces outside your home. Avoid touching your eyes, nose, and mouth with unwashed hands. And stay home if you are sick and get tested if you have signs or symptoms of COVID-19. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us. COVID-19 cases in Ontario is increasing rapidly every day. With more than 4,000 cases every day in Ontario, the 7-day average is almost close to what we have seen at the peak of second wave in January. This is deeply concerning for all of us to see the cases increasing in Ontario. Today we reported 93 cases in Windsor-Essex, a strong reminder that we could be heading in the same direction. Majority of these cases are close contact, 36 of them, 28 are community acquired. We need to be vigilant. We need to be cautious in everything we are doing. We need to make sure that we are following the public health guidelines to ensure the safety of our own self, our family, and for the entire community. I still believe that we can avoid a major surge in cases in Windsor-Essex. It is absolutely critical that we must do our part and follow the public health measures. With the ongoing vaccine rollout, we are doing our best to protect our residents, but just the vaccines will not prevent the transmission of COVID-19. We need to stick to our public health precautions until our coverage rate is high enough and our transmission level is low enough. We have an opportunity as community to come out stronger when the stay-at-home order is lifted. Please continue to follow the public health measures. Thank you.
We'll now take questions from the media. Is there any questions from AM 800?
Teresa, just in regards to the number of people that passed away recently, do you know if any of those cases have been from the variant?
I do not have any information about that, Rob.
Okay, thank you. Dr. Ahmed, I was looking at different areas and I noticed obviously London, they're nearby, their numbers are going through the roof and they just confirmed the Brazilian variant. I know, like you mentioned a couple days ago, the investigation and looking into these cases is still ongoing. Are you concerned that we might have other variants in our region compared to the, not just the UK variant?
Well, we do get reports regularly, and we do see some of those cases that are being reported to us. And the preliminary indications, it does try to separate out the different types of variants that are currently circulating, but we don't necessarily are able to comment if these are the Brazilian one or which one that we are dealing with, unless we get unless we get the confirmation from the lab. There are some criteria, some classification that they use, but sometimes it's difficult to say with certainty. So we try to stick to any of these variants could have the same potential in terms of the spread, and these variants are the reason for a rapid transmission. The transmission rate could increase significantly by 50% or up to 30 to 50% in most of these cases dealing with the variants. So it really is important to know that these variants are in our community, and at least 1/3 of our cases that we report are now from the variants of concern, and in some days we are coming close to 50% of the cases. So I think we can pay more attention to the type of variants that we are seeing, and we could have all kinds of variants here. But I think it goes back to the main idea of ensuring that these variants are here in our community. There are a significant number of people who are contracting COVID as a result of community transmission. So we need to ensure that we are following all these public health measures and protecting ourselves. I'll try to see if we can be more specific in terms of the type of variants that we are seeing, but I do worry that in the absence of a confirmation, it may not be as accurate as we like it to be, but we do get all kinds of variants reported to us.
And finally, just sticking with the variant, for people that don't know, and you've mentioned this a number of times, the variant obviously spreads quicker. With the cases that we're seeing, the close contacts, 36 today, like you mentioned, and it hasn't been reported, obviously, you haven't mentioned it, but if there is a close contact and they have the variant, obviously that transmission could escalate even more. Absolutely,
and this is what we are seeing, that especially when we have a case with variant, the entire household, they get sick, and then anyone who's identified as close contact, they acquire the disease at a much rapid rate than the others. And this is exactly the risk is with all these variants of concerns, and further reinforce the importance of following our public health measures. And we have said it before, and we try to make it clear every day as well, that mask only is not the solution. Physical distancing and masking is what everyone need, and ensuring that you're washing your hands with alcohol or hand sanitizer or with soap and water regularly every time you're coming in contact with. So those are the key messages that we always remind. And on top of that, obviously, anyone who doesn't live in your household could be at a risk, and you need to take precautions every time you're connecting with them.
Thank you.
Any questions from CTV?
Hi, yes, good morning. That's quite the spike in cases today. Have we sort of not been taking advantage of our typical delay behind other regions in the stay-at-home order to keep our cases in check, or was this always going to happen?
Well, I can't say at this time that this is an anomaly or this is a trend. Right now, we have seen there was a day when we reported close to 70 cases, but then we went back to 30 or 40 cases, which had been our average for some time. It should be lower, but we are still there. But I'd like to see if it I hope I like to see that we don't see that as a trend moving forward with higher number of cases. And it's just an anomaly, but it would be too early. It is possible that we are seeing a late impact, but I truly hope that it's not, and it's just an anomaly, and we can get back to our regular or even less number of cases that we were seeing. But we need everyone to make sure that this is a very critical time, especially when variants are circulating, when there's a lot of active cases in our community as well as in other communities. Every community is seeing a surge. And in Windsor-Essex, we have been lucky so far, and we really should make a good use of this opportunity to keep our case counts down.
Thank you. And I was wondering if you could speak to the health units vaccination plans at the Southwest Detention Center. I understand that starts on Friday. Does that plan include staff and inmates, and about how many people are expected to be vaccinated?
I'll pass it on to Teresa to answer.
So we will be vaccinating on Friday, as you indicated. So the people that are in the detention center will be vaccinated, and I believe it's close to 300 people. And any of the staff that are working there that day will be vaccinated. Other staff that are eligible for vaccination will be asked to go to one of our mass immunization clinics.
Thank you.
Any questions from CBC?
Yes, today Mayor Verdilkins expressed frustration on our morning show over the supply of vaccine that we're getting, mentioning that we're getting less now than we did a few weeks ago, and I know that was reflected in last week's EPI summary. So I wanted to ask, did you ever expect that we'd be seeing less vaccine, not more, at this stage in the game? And what specifically is driving the reduction that we're seeing? Is it boiling down to what's happening with Moderna?
Okay, so I'll start. Our vaccine supply has been fairly steady with the same amount for some time now, and we know that that will continue into toward the end of May. So Pfizer has been basically 10,530 doses, and we're using Pfizer primarily for our mass immunization sites. And Moderna, we received between 2,000 and 3,000 doses. And the Moderna vaccination or vaccines have had a little bit of delay, but we are receiving the Moderna as well. So we are fortunate to have both combined. And then as well, we have AstraZeneca being delivered through pharmacies and through some primary care providers. So the amount of vaccine in Windsor and Essex County has basically been the same for quite some time. There were, I would say maybe a month ago or a little bit longer, we were getting about 14,000 doses of Pfizer. The ministry has, we've been part of pilot projects, and I think I've shared that because of our participation in pilot projects, we did proceed a little bit further ahead. And I think there's just trying to acknowledge that there are many vaccine needs across all of the health units, and the ministry is doing their best with the allocations. And so all of our planning is based on what we know, and we know that the Pfizer is the amount that I've shared, and Moderna between 2,000 and 3,000 doses, and we're making good use of every one of those doses for our community.
Thank you very much. Just to switch gears a little bit, I also wanted to ask about the opioid overdose alert that was issued yesterday, the fourth one this year. Do either of you have any thoughts you'd like to share on that?
Well, we are seeing some of the impacts of not only the pandemic, but also on the mental health and well-being of individuals. These drug-related overdoses are becoming more and more in our community, which is a significant concern. And we do recognize that the pandemic has a different kind of a toll and impact on every individual, and the mental health and mental well-being, especially with people with addiction or a pre-existing mental health conditions. they are at a high risk of developing more of the severe consequences and the impacts of COVID-19. So it is unfortunate that we are seeing that in our community, and some of the key messages we continue to reinforce is the availability of naloxone and ensuring that people are who use drugs for one reason or the other, they're not using it alone. They have access to a naloxone kit, and if you have a loved one or someone that you know uses opioid for any reason, you should have a naloxone kit available as well in the event if there is an overdose, then they can be used. And for people who are getting their supplies, ensuring that they be mindful of who they're getting their drugs from, and if there's a contamination or tainted drug supply or something that exists in the market, and just take precautions. And I know it's a community, it's a big toll, and we haven't seen the full numbers of how many people actually died, but there are people who are dying as a result of overdoses as well. So we all need to be vigilant, and especially the agencies who work with these population, to be aware of the trend and ensure that we're all doing our part in preventing these overdoses and potential deaths.
Thank you. Any questions from Blackburn?
Yes, we had a call from an individual who said that she was on the fence about getting a vaccine and felt that it would go a long way to her peace of mind if leaders in the community got the shot. So we wanted to ask you whether either of you have received your vaccines yet.
Yes, we have, as part of the phase 2 priority, we have received the vaccine, and surprisingly enough, both Teresa and myself, we truly think that the vaccine is the best way to protect yourself, and all the vaccines that are available have some benefits, and most of the people in the high risk groups, they all received the vaccine, and we are seeing a good impact on the vaccine in our long-term care home and retirement home. So these vaccines are very effective, and I'll let Teresa comment on her part.
So I do want to confirm that I did receive the AstraZeneca vaccine at a pharmacy, and it's been a few weeks, and so I am vaccinated with my first dose. So if that influences anyone or provides, any assurance that take the first vaccine that's available to you and get protected as quickly as possible, then I hope that helps.
We also had a call from someone who indicated that people from other parts of the province can book locally. However, when they tried to book in another city, they were unable to. We wanted to ask, is that accurate? Can we book in other communities? And what can be done, I guess, to address that?
So the booking system, the provincial booking system, does allow that. And we do know that locally we've had about 1,300 of our residents receive their vaccine elsewhere in the province outside of Windsor and Essex County. So that is, not encouraged. We would like people in Windsor and Essex County to receive their vaccine here. And, because we're all dealing with limited vaccines, but we do know that we have vaccinated people outside of our region as well. People living in our region have gone elsewhere. So it does occur, and it is what it is at this point.
Are you worried about running out of vaccine earlier than you might because of out-of-towners coming here? I know the CBC had a report the other day saying that 4,000 shots went to out-of-towners. Are you concerned that we could see ourselves in a short spell as a result?
Well, we are tracking this, and the nearly 4,000 people that received their vaccine in Windsor that were outside of Windsor were through the pharmacy initiative. We were able to see that, and that was at a time where other municipalities surrounding us did not have access to the vaccine. So people were accessing our Windsor-Essex County region through the pharmacy program because they didn't have that access in their own communities. As we know that the province has opened up pharmacies in other areas, there are now over 700 pharmacies across the province. We've also dropped ages, so that has helped as well. So we received people from out of our area based on the fact that our age grouping had lowered and others were not at that point yet. So as we all kind of equalize the ages and we're focusing on the same priorities, there would be no reason to come to another area. It would be inconvenient, and I think we're all using the vaccine as best we can. When you're saying running out of the vaccine, primarily people from Windsor-Essex County are getting, like 99% are from our area and through our mass immunization clinics. So we are vaccinating people from our area.
And finally, are you worried about the growth in cases involving variants of concern outpacing the rate of vaccination in this region?
So, as I said, we cannot rely completely on the vaccination to prevent these cases. We have to act as individuals to ensure that we are following public health measures. The vaccine helps in further reducing the transmission, but overall, our actions define how quickly the virus spreads in our community. So I don't want to undermine the importance of taking public health precautions, especially when the vaccines are here. The vaccines prevents people from developing more severe complications or hospitalization and death, and which we have already seen the benefit of it. But I wouldn't rely completely on that. We all have to be responsible when we are outside and ensuring that we are following all the public health measures to prevent the transmission. So yes, it is a concern, but I wouldn't tie necessarily it with the vaccine rollout.
Thank you very much.
Any questions from Windsor Star?
Yes, good morning, Teresa. Good morning, Doctor. Is there any indication that today's high case count could be attributed to some lab backlog?
A good question. I don't think so. We can double check on that, but generally we do get flagged if we are seeing a surge because of some backlog. But at this point I would say no, but we'll double check and we'll confirm if that was the case.
Okay, and on to the pharmacy vaccine rollout. Do you know if all or most of those pharmacy doses are spoken for?
So we do know that pharmacies that have used up their allocation, that they are asking for more, and in some cases they're getting more from the province. So the ministry is doing those allocations, and so we do know locally that we've had conversations with some of the pharmacies that were asking for more, and then right before our conversation they said, oh, we got confirmation of another 300 doses. It seems that the pharmacies are moving it very, very well by appointments, and not probably getting as much as they have the capacity to give, but they are able to administer what they do have.
Okay. That means that if an individual is on, say, a wait list with a pharmacy for an appointment, pharmacies are still getting more doses. They likely could expect to receive a phone call for an appointment.
Well, and I can't speak for every allocation because I don't know what pharmacies have on hand and what they've booked, but overall they are using the booking method, and the ministry is keeping an eye on allocations in the pharmacies and providing more vaccine as they're able. So I think it's, we're all using the vaccine when we get it, and they're getting whatever they'll take whatever they can get. So from our perspective, if you're on a wait list, speak to the pharmacy and ask when they think their anticipated allotment will come, and hopefully they get vaccinated very quickly.
And have you heard anything from the ministry on when you might expect to expand the age eligibility in our region?
We have not heard anything from the ministry about age bands right now. The focus has been on the high priority postal code areas and access to people in those areas. And right now in Windsor-Essex, it's 50 years of age and older. And we are also providing vaccinations for people that are special education workers. So no further direction regarding lowering the age group. Right now in our regular mass clinics, it is still at 60 years of age and older.
Those individuals listed under phase 2 as having very high risk health needs, very specific lists, I know. Are those individuals making appointments and being vaccinated through primary care providers, or primary care providers creating a list and making them appointments through the mass vaccination clinic?
So it will seem a bit complicated, but this is how it's being done. So those in the highest risk, those people with the highest risk medical conditions or high risk, the highest risk and the high risk medical conditions, Windsor Regional Hospital and our health unit worked together to provide physicians with a template to identify their patients in those categories, and then they submitted that to through a secure system and have been booked. So any physician that was providing their list to Windsor Regional Hospital, they were being contacted and being booked for a vaccination appointment. So they have done quite a few people, and through the mass immunization clinics. Now we know that very soon, so those are the highest risk and the high risk. There's still an at-risk health condition, but people with these at-risk health conditions are not being vaccinated at this time. The other two groups are, and we know that we are looking at our booking system right now to try to streamline that process. So probably in the next, today's already Thursday, but probably in the next day, we will be providing another avenue to capture people that have not been vaccinated yet, that are in those highest risk and high risk medical conditions. I know it sounds confusing, but essentially we are vaccinating and have vaccinated a lot, like thousands of people with those medical conditions.
You explained it very well, although it is convoluted. Thank you.
Any further questions from AM800?
Teresa, just in regards to the hotspot postal codes, I believe you said previously the province determined that, correct me if I'm wrong there, but if we notice some other areas, for example, in our area, the variants out there, I know we have the schools out there that are seeing more cases, could these hotspot postal codes be changed by our local health unit?
There is a message or a direction in one of the guidance documents that says if this changes, the health unit can look at data and bring this forward. But we do feel that right now the identified postal code areas for Windsor and Essex County are reflective of what we've seen through this pandemic, what we're seeing now, and are quite accurate for our area right now. Could they change? Yes, but right now they seem to reflect what we've known all along.
Thank you.
Any further questions from CTV?
Yes, hi. I know you had addressed this a bit the other day, but we heard a small amount of people aren't showing up to their vaccination appointments. What is being done with the vaccines that aren't used? Is there like a list in place that people get called in if there's a no-show or anything like that?
So for our extra doses at the end of the day, we actually try to avoid that. So we are only drawing up enough vaccine that we are able to use based on the people that are booking appointments. So early on in the pandemic, not in the pandemic, in the vaccine rollout, when there were lists and people that were called in that were part of the prioritized group. So every mass immunization clinic, they are still asked to have the ability to reach out to people that are in that prioritized group. So if we're vaccinating people 60 years of age and older, and if there are people that are scheduled for vaccine, they may be asked to fill in a spot. But actually, all of our mass immunization clinics have been very aware of the amount of vaccine. So if they have 14 people booked in an hour and only 10 people come, then they know that's the equivalent of, that they have those 4 doses. So they're not drawing up vaccine for the whole day. They're doing it in increments and really aligning with what, if people are attending and filling all of those vaccination appointments. So we're not seeing a lot of, that happening a lot because of the careful, drawing up and having a very good system in place and not being, drawing up for the whole day. But it does still happen, and we're anyone that, if there are extra doses, the extra doses are for people that are in the current eligibility criteria. So that's who would get vaccinated.
Thank you. And just in regards to the kind of jump today, I know that you had said it might be an anomaly, but I understand that some patients are being transferred to our hospitals because the third wave is taking a hold. Is there any comment you have on that, or do you foresee that being an issue?
So I did talk to Windsor Regional Hospital, and they did say that they haven't received, up until yesterday when I talked to them, they didn't receive any patients from outside of the region. So it's not an issue at this time. I think as a province, as a healthcare system, if there is a need, we need to step up and we need to provide that need. In the past, in January, when we had more cases in our region and we had to send our people to different hospitals outside of this region, so that happened too. And so I don't think that this is a concern. The concern only becomes if our people need an ICU bed, or our people need that kind of service in the community and they are unable to get it, which I'm sure would trigger further conversation in terms of how many people we can accept and how we should prioritize them. Clearly, our hospitals, our systems are more, serve the purpose of supporting the community, our local community rather than others. And but if we get to that stage, we'll definitely have to make some of those decisions and tough choices. But so far, I think we need to step up and provide the support that others have provided us in the past, and provide the care that everyone needs.
Thank you.
Any further questions from CBC?
No, thank you.
Blackburn?
I'm good, thank you.
Windsor Star?
Can you give me an estimate of how many special education workers have been vaccinated so far?
I don't know how many have been vaccinated so far, but I would say the majority are all booked for this week. So some were done on the weekend, and I think we were close to, I would say, probably about 2,000 people that were booked. So we did have lists from the school boards, and I would say that around that amount. And so probably by the end of this week, all of those people that were submitted by the school boards should be vaccinated.
And once that group is complete, are you looking to move on to a different group of essential workers, or are those plans in place yet?
We do have some plans in place, so stay tuned. We'll share those tomorrow, but right now it's the essential or the special education workers. So.
Okay, thank you.
Thank you, everyone.